This is particularly pertinent, I think, for high schools because the older learners are moving into the area of higher risk just by dint of their age. MEC, do you have specific protocols for when a school might need to close? Is it based on infection levels? What is it that is the decision made by individual schools? Share with us what those guidelines are, just so everybody listening will have a good understanding. If hopefully this doesn't arrive, but just in case it does.
Yeah, we have operating standards, and those operating standards we have sent them to all our schools. Basically, the rules is the first thing first, it's safety first, which simply means that every school must ensure that everyone sanitizes, the social distancing, everyone's wearing a mask. That's a must. Secondly, we must have what we call the safety room. So anyone that feel ill or they don't feel comfortable, there must be an isolation room. And that isolation room is linked to a local clinic, which simply means that either a nurse or a doctor will be dispatched to come to a school if somebody feels they are not well. If there's somebody that has tested positive, the area in which they're in, that area will be isolated, and that particular individual will also be asked to isolate 10 days or so, depending on the advice that we get from our legal team. We are linked up with the Department of Health, so they are guiding us on every step of the way to ensure that everyone is safe. But if there's somebody with comorbidities, either they are sick and other things, we're advising them not to report for duty without declaring the underlying illnesses so that we can monitor that situation and we can be aware. But in terms of learners, we are rotating them because we can't bring all of them at the same time. So we are running at 50% capacity.
News.
Experts.
Analysis.
Where things stand.
What you need to know. Drive home with John Perlman
On 702.